afternoon. I'm an emergency physician. I've been working in the ER for 20 years. I wanted to tell you about a patient I took care of last week in my emergency department. His name was Joey, and he came in when he was 22, but his story started 3 or 4 years before that. He was a roofer. He was working in his uncle's roofing company since high school, and he was doing really well. It was long days in the hot sun, but he was working hard, and he was making money and pretty proud of himself. And then one day he slipped off the roof and he broke his leg. And he was in a cast for about 12 weeks, and he was prescribed opioids for pain. And during that time, he was getting better, his leg was getting better, and then he needed surgery, and he got refills on his opioids. And then, over time, he was taking a little bit more and a little bit more, but he went back and forth between his orthopedic surgeon and his primary care doctor, and he got refills, and that was all okay because he had insurance and he could see doctors. But over time, he couldn't go back to work. His pain got worse, didn't get better, and he still needed to take more and more opioids. So ultimately, he started buying pills on the street, and they were easy to find, but they were costing a lot of money. He lost his insurance, and he was unable to work. So he started buying heroin, but he said he would never inject it. And then shortly after he started using, he started injecting, but he didn't think that was going to last long. Ultimately, he found himself in a really bad place, and he didn't know how to get out of it. He overdosed one night, and his parents came to his rescue in the emergency department where he had been resuscitated. They got him into treatment, and he did 30 days in treatment, and he was clean for 33 days, and then he relapsed. And it was a cycle like that for over 2 years. And then finally, he was arrested on a drug charge, and he was incarcerated for 6 months. His mom told me that when she visited him in jail, she felt guilty because she was so happy that he was safe. Then I met him when his mom found him on his couch, blue and not breathing. He was brought to my emergency department in cardiac arrest. We did everything we could, but we couldn't save him. So I went outside to tell his family, and that's when I met his mom and his uncle. And I had to tell them that their 22-year-old had died, and she had to bury her son. So what are we doing that this is common for emergency physicians to have this in their practice now? 22-year-olds dying every single day. So last year, 27,000 people died of drug overdoses of opioids. And it's all happened because we've liberalized our prescribing. The green line there represents the sales of opioids over the past 15 years. They've quadrupled. We liberalized our prescribing because we forgot that these drugs are highly addictive. Those deaths occurred in parallel, and the CDC said we had an epidemic of patients with addiction. The yellow line represents patients who get into treatment, and that's also escalated. At the beginning of the epidemic, the map of the United States illustrates the darkest states where the epidemic began, states like Maine, states in the South. And then over time, patients who needed to be admitted to treatment centers continued to grow. Every year, more patients needing to be admitted to treatment centers. And these are the lucky ones who actually get into treatment. If you stop now, every community and every state is affected, and that's where we are. We're trying to figure out how to stop this epidemic. What can we do to stop? So I want to tell you, the lucky kids, or not so lucky kids like Joey, who are actually able to access treatment. Many of them come to my emergency department and they can't access treatment. They don't have insurance, they don't have advocates, they don't have parents anymore who are available to help them. For the people who do use prescription opioids and run into addiction problems, only 1 in 3 have sustained recovery at 4 years. For those who use heroin, the results are even more abysmal. So unfortunately, we need to change our practice. We need to scale back this liberal prescribing. And we need to do that by retraining our physicians, my colleagues, my trainees, and the public to understand the limits and the dangers of these drugs. So how do you stop an epidemic? How did we stop Ebola? How did we decrease HIV? We do it by preventing new cases. And that's what we need to do here. We need to keep patients who are opioid naive. So I wanted to just share both with you and my trainees and my patients a study that we did a year ago and we published. We surveyed emergency physicians around the country about their hypothetical prescribing of patients with an ankle sprain or ankle fracture. Who would give them opioids? Who would not? The red bars represent the responses of emergency physicians for patients with ankle fractures. So if that patient was an adult, hypothetically, 86% of emergency physicians said they would prescribe opioids. If it was an adult member of their own family, though, 10% less said they would prescribe opioids. If it was a teenage patient, even less would prescribe opioids. But if it was a teenager in their own family, only half as many physicians said they would use these drugs on their own family member. I have teenagers. I know that's the vulnerable time in patient development. And their brains are young, they're immature, they're so vulnerable when they're exposed to these drugs. So if I wouldn't give them to a patient or a family member, why should we let patients convince us, or how can we spread this to patients without telling them that we wouldn't use it on ourselves? We even asked about ourselves, and most emergency physicians wouldn't even prescribe these if they were the one who was injured. Another study that we did last year, we used narrative vignettes like the stories of Joey and so many other people who I've taken care of. And we tried to translate those vignettes for emergency physicians to remind them about their prescribing habits. And we were able to actually demonstrate a big difference in helping physicians remember prescribing guidelines. So we just got a grant from PCORI to use narrative vignettes like these stories to actually tell patients at the time of their prescription. So a patient with an acute injury in the emergency department, we want to show them a video vignette of a patient who said, "I wish I had never taken my first pill," at the same time that they have to make a decision, do I want opioids for my ankle fracture or do I want Motrin? And at that time, we can give them a chance to make their own informed decision about what they want for themselves. Thank you.